The demand for doctors around the country continues to rise, but it's rural communities right here in Wisconsin that some are the most underserved. Valina Jones tells us why and tells us what a med program at UW is doing to improve care for those areas. Valina?
That's right, Danica. They're really focusing on those areas. High rates of projected population growth, especially among the elderly, and shifts in demographics of chronic diseases and health risks are just some of the factors for the expected increase. But the number of doctors available to treat those patients isn't keeping up.
Oh, I wanted to live and work in a rural area long before I wanted to go into medicine.
But after working as an EMT in his hometown of McFarland, creating special bonds with patients became Evan Cretney's mission.
I loved caring for patients, showing up at their house in the middle of the night when they really needed something and being able to take care of them was really a rewarding experience and something I knew I wanted to do for the rest of my life.
It's why he decided to apply for UW's Wisconsin Academy for Rural Medicine. The program trains medical students to become doctors in rural areas. With 28% of Wisconsinites living outside of big cities, only 11% of doctors have practices in those areas.
It's kind of scary. I mean, a lot of times this means people have to travel 30, 40 minutes, maybe an hour, just to see their primary care doc. And if you have a chronic condition that requires intensive management, that's a really, really big burden.
83% of counties in Wisconsin are considered underserved. Out of those counties, 77% are rural, numbers that are expected to increase with the U.S. facing a shortage of 90,000 doctors nationwide in 10 years, according to the Association of American Medical Colleges. A shortage the second-year med student sees firsthand once a month, working at a Dodgeville family practice.
It becomes hard for them to get an appointment. The doctors become overworked. They're expected to take care of that community, and if they are short-staffed and don't have enough support, that becomes very difficult for them to do a good job as a doctor and to just enjoy their life.
For Cretney, it's more than just about filling a need, but making relationships.
You can meet them in the coffee shop when you're stopping for coffee in the morning. You see them driving down the road. They're your friends as well as your patients.
Now, students within this program spend their first 2 years studying in a classroom and the last 2 years in a rural learning hospitals to get that hands-on experience.
Yeah, super important. And this is important for patients and doctors alike, it sounds like.
Exactly.
Yeah. All right, Valina Jones reporting for us tonight. Thanks so much.